Thanks everyone for joining in. We want to apologize we weren't able to have the ACO event last week, but we're glad that we could record this presentation so you all have access to it. This is Joanna Loomis with the ACO, and soon Dr. Karen Williams with Complete Family Care and one of our medical directors here at the North Country Initiative will be joining to deliver the presentation. Enjoy.
Hi, everybody. It's Dr. Williams. Thanks for joining us. I know this is not the most ideal way to get this presentation, but we want to get this information out to all the partners as soon as possible. We're going to talk about a few things today. We're going to go through a little bit of the background of the ACO. We're going to do a little 2018 year in review and recap some of our prior campaigns. We'll go into the 2019 campaigns, at which time we're going to turn it over to you guys to work on your strategies for 2019. With that said, we're going to move on. Thanks. So as most of you are aware, we're all part of an accountable care organization called Healthcare Partners of the North Country. In January 2018, we signed our second 3-year contract, and it's a shared savings contract. We currently care for approximately 11,000 attributed lives. Our average 12-month cost is about $9,500, and our benchmark for 2018 is just over $10,000. Just to recap a little bit about how the ACO works, if you are successful in lowering costs, meeting your quality performance standards, and keeping your costs underneath your beneficiary benchmark, you will receive shared savings. So if everybody remembers back to around last March, we launched our 2018 campaigns. We stuck with some standard initiatives, which were annual wellness visits. We talked about HCC coding, the patient outreach campaign. Last year, we introduced disease-specific care management, and we focused on CHF, and we introduced transitional care management as well last year. So in 2018, our annual wellness campaign was very successful. Through October 31st, the ACO had done over 5,000 annual wellness visits, and we continue to prove over and over that those patients who have annual wellness visits have lower costs overall. HCCs is another topic that we continue to talk about every year. Since we introduced this topic, we have been successful at improving the ACO's overall HCC, and HCCs tend to reflect the risk of the patient. If there are higher HCCs, the insurance company assumes it's going to cost more money to take care of them, and that helps increase our benchmark. We continue to stress HCCs because moving forward, all of our value-based contracts are going to be impacted by our patients' HCCs overall. There's a few different tools that we've introduced. We did buy a webinar this year. There is a copy of that you guys can all go out and see. We would encourage all the providers and anybody involved in the billing and coding to watch this, because we can pick up on some really easy ways to improve our HCCs. For instance, if we remember to code morbid obesity as well as the BMI, we can increase a risk score. Or if we code diabetes with other complications and include a complication such as hyperlipidemia, we can improve the HCC score. Additionally, you have diabetes with chronic kidney disease if you also code the chronic kidney disease. There's some really good tips to improving your overall HCC scores, and we encourage all of the providers and billing people to go out and watch this and learn from this and continue to focus on HCCs as we move forward. In 2018, our patient outreach campaign continued to be successful. We were able to identify beneficiaries who were going to be lost from the ACO, and we were able to bring them back into the ACO. Overall, these patients have a much lower cost, and it's important that we continue to focus on patient outreach. We also introduced the disease-specific care management. Through this, we spent some time training all of the care managers in the offices on CHF. We also provided some provider education with Dr. Scott Feitel coming, and we've started to really look regionally at how we care for our congestive heart failure patients. This was a great learning exercise for care management. It's really helped us learn how to address certain patient populations, and this is something that we'll continue to work on moving forward. In 2018, we introduced Transitional Care Management, or TCM. TCM involves caring for our patients as they transition from an inpatient facility back into the community. And we have shown, despite the fact that we didn't really start this campaign until May, almost halfway through the year, we've saved over $1.5 million based on 90-day post-discharge costs by successful TCM. Despite the fact that we did not make shared savings, we do have a lot of lessons learned. And our 2018 data does not appear that we will make shared savings either. But there were some things that really helped toward the positive. We were able to engage more beneficiaries. Note that we really improved our annual wellness visits. We have transition care management that began so it's a pretty big and lift, and we're learning more and more every year as we go through this. However, there were some things that did not benefit us. We ended up over our benchmark. We had a 28% claims lag in Part A claims because of complicated billing with hospitals, and we also noticed a very big increase in our hospitalization costs in the fourth quarter. What we've done differently this year was develop our campaigns early and make them inclusive for 2019, hoping to continue to build on the successes that we experienced in 2018. So as we move into the 2019 campaigns, we're going to talk a little bit about how we develop the campaigns. We're going to talk about some of our standard initiatives, what our 2019 campaign initiatives are going to be, and we're also going to talk about the 2019 reporting schedule. So for 2019, we did things a little bit differently. We started to develop our campaigns back in the fall of 2018. We reviewed all the ACO data that we had to date, and we tried to find the places that were going to have the greatest impact. We had meetings with different ACO subject matter experts or people with the most experience in different categories, and we really tried to make these campaigns something that would be the most beneficial to our patients. After that, we actually met with all of the ACO partners to further develop and refine the proposed campaigns, make sure that the campaigns were going to be something feasible for all of the partners, and then in November of 2018, all of the campaigns were approved by the board. So what do you have to expect in 2019? Well, we're going to continue with some of our standard ACO initiatives. Quality reporting will still be required. We're still going to need provider engagement. Without providers engaged in what we're doing, we won't continue to build on the successes that we've had. We need to continue to focus on HCC coding. Again, this is where our risk score helps improve. This helps improve our benchmark, and it really will reflect the accuracy and the sickness of our patients that we're caring for. We need to work on our beneficiary roster maintenance, making sure that we're noting when patients are no longer in our facilities or we're no longer caring for certain patients, and we certainly have to continue to focus on our annual wellness visits. As we have continued to show, this is a successful campaign, and the patients who have their annual wellness visits do have lower costs. 2019, we're introducing 5 campaigns. One is patient outreach. That's not new. Care management, there's some changes to that one. We have an influenza and pneumonia vaccine campaign that's a little different than just doing shots. We're also going to introduce some hospice and palliative care campaigns and a campaign around skilled nursing facilities. As I previously said, in 2018, our patient outreach campaign continued to be successful. We have shown that we can continue to build upon this success by trying to regain or maintain as many patients as possible within the ACO. So our goal for 2019 is to maintain about a 70% successful patient outreach. In 2017, we were successful in about 41% of the time, and that contributed to nearly $8 million in savings. So if we can reach the 70% mark, we can look at almost $17 million in potential savings through the patient outreach campaign. In 2019, our care management campaign is going to build upon the successes that we've had through disease-specific care management, TCM, and training all of the care managers over the last few years. What we're going to do is we're going to identify high-risk patients. We're going to kind of do some prospective risk stratification rather than retrospective using the Johns Hopkins predictive risk model. This is a tool that we have available in our population health tool, and it will use all the patient's diagnoses and past history and come up with a risk score. Any patients with a risk score of 2.0 or higher will be identified. Lists will be shared with partners of who the high-risk patients are, and then we'll be asking everybody to care manage these patients in a meaningful way to try to result in reduction in hospitalization, reduction in ER use, and ensure that we're getting TCM visits for up to 75% of our qualified discharges. When we talk about care management with these patients, it's important that we make sure we're not only thinking about chronic care management or the billable services through Medicare. We're going to be asking that partners provide us with a care management strategy for 90% of their high-risk patients that are identified. That strategy may vary from patient to patient. If patients can be enrolled in chronic care management, that's ideal because it is a billable service through the office. But if not, you may have a different strategy for these patients. So they might be coming in for more frequent office visits. They might get more frequent telephone calls. Just because a patient does not consent to CCM doesn't mean that they cannot be care managed. And this is the feedback that we'll be asking for from the practices. While we all know it's important for our patients to have flu and pneumonia vaccines, we have included this as a campaign in 2019. Slightly different than just saying we want everyone to have a flu and pneumonia vaccine. We're identifying the top 500 utilizers within the ACO. They are going to be shared amongst the partners as well as other patients who have been identified as high risk for flu or pneumo, so that we can really try to get these patients vaccinated. And it's not just everybody agrees that they should be vaccinated. We've provided a toolkit to partners with some strategies to help combat patients who decline the vaccines, following up with patients who decline the vaccines, and really stressing the importance for our beneficiaries to have their flu and pneumonia vaccines. As you can see, just by targeting this high-risk population and the high utilizers, we have a potential savings of over $1.5 million for the ACO, which is a pretty big impact. Hospice and palliative care has been identified as an area that needs to be focused on a little bit more within the ACO. We have found that our ACO beneficiaries have underutilized hospice and palliative care towards the end of life. We're about 15% below the national average for use of these resources. Understanding that we underutilize hospice and palliative care services, what we'd like to do is start to shift the referral pattern. We want to avoid the catastrophic hospitalization that might not have had to happen had a MOLST form been involved, had a hospice referral been made earlier. We'd like to shift the referral pattern from the inpatient setting to the outpatient setting. We'd like to increase our hospice engagement when appropriate and do it from the office rather than from the hospital. We'd also like to try to improve or increase the average length of hospice stay, because all the studies show that if we can get patients into hospice just a little bit earlier, they can benefit more rather than waiting until the last minute and having them only receive benefits for a couple of days. Our final campaign for 2019 is our skilled nursing facility campaign. Here we'd like to focus on our patients who are in the skilled nursing facilities, we want to ensure that we're avoiding unnecessary hospitalizations or rehospitalizations, and we also want to ensure that they're getting adequate transitional care services when they do get discharged back into the community setting. Our focus is going to be on improved communication between the skilled nursing facilities and the providers to make sure that these can happen. Now that we've reviewed the 2019 campaigns, and just so you know, all of your ACO points of contact have these campaigns in a packet form with the details and the specifics. We really wanted to do a glance over of the campaigns tonight so that it isn't taking up all of our time. We're going to review the reporting schedule, and then we'll be able to move on to strategizing for 2019. The reports that your ACO point of contact will be getting in 2019 monthly, you're going to get your patient outreach and your care management reports. The first care management report actually went out in end of December or January, and we're not going to start again until the end of March because we wanted to give practices about 3 months to kind of get their feet under them and figure out what they were going to do. But after March, it will be monthly. Bi-monthly, you'll be getting your ACO facility averages, and that'll be shown against the benchmark so you can see where you stand. Quarterly, you'll get your TCM reports, your ACO roster, your HCCs and your possible lost HCCs, your annual wellness visit information, as well as your out-migration information. The out-migration information at this point is very informational, just kind of to be aware that it exists and that our beneficiaries are getting care outside of our ACO. Finally, you'll get your flu and pneumonia reports seasonally as appropriate so that you can focus on those high-risk patients. So I hope you can see that by looking at where we've been and how far we've come and what our plan is moving forward, that all of our small changes that we continue to make are making bigger and bigger impacts on the patients that we take care of. And now that we've gone through everything, the ball's in your court. It's your turn to try to figure out how you can tackle these projects and these campaigns together. Each of our medical directors has shared their operationalization strategy with all of the ACO partners. It's a good way to look at some of the different ways different offices are able to or thinking about these different campaigns. There's no one right answer, and every office is going to have a different solution. So we want you to come up with what your ideas are. And next month, we're going to get back together on March 6th, and we're going to share some of our successes. We're going to share some of our strategies, and we're going to look at how everybody is doing things and see if we can learn from one another and continue to improve through 2019.